VISN 8 Work-Life Leave and Award Unit. This morning, I will be presenting to you the Family Medical Act FMLA. This presentation will be recorded just in case anyone needs to go back and listen to it or share it with their peers. The learning roadmap is the following. We're going to be talking about the background and purpose. We're going to go over the key points, the eligibility, how to apply, what can a supervisor ask, common administrative problems, and we're also going to have a Q&A at the end of the presentation. So I would ask that you guys, wait till the end of the presentation to ask questions, or if you want to send questions through the chat, my team will be available to help me answer those questions while I present. The background and purpose of the Family Medical Leave Act, FMLA. President Clinton signed the legislation in 1993. The Family and Medical Leave Act confided as a simple and fundamental principle. The quote was, workers should not have to choose between the job they need and the family members they love and who need their care. The key points of FMLA. FMLA is a leave without pay LWAP program. An employee may, at their own discretion, elect to substitute annual or sick leave in lieu of leave without pay. Maternity, paternity, adoption, foster care, FMLA, paid parental leave, which is PPL, qualified employees are entitled to up to 480 hours of paid leave. FMLA entitlement is for 12 weeks, which is 480 hours, which equals to 60 days for a 1 point FTE and prorated for part-time if 12-month in a 12-month period. Must have a serious health condition. This does not include routine physical, eye, or dental examinations, a regimen of continuing treatment that includes that includes taking over-the-counter medication, bed rest, exercise, and other similar activities that can be initiated without a visit to the healthcare provider. A condition which cosmetic treatment are administered unless inpatient hospital care is required, unless complications develop, or an employee's use of an illegal substance, or unless the employee is receiving treatment for a substance for abuse by HHCP. Who's eligible to apply for FMLA? An employee for at least 1 year with the federal government in accordance with the 5 CFR 630-1201. An employee must have completed at least 12 months of civilian federal service, not required to be a 12 recent or consecutive months. Does not have to be consecutive months, meaning that if the employee worked previously in a federal civilian job or came out of a federal civilian job, they could go ahead and use those hours if they turn in their SF50 and the time in service is available. An employee or family member of an employee must have a serious health condition, and a serious health condition is defined by the 5 CFR 630-1202, means an illness, injury, impairment, or physical or mental condition that involves inpatient care. Example, like an overnight stay in a hospital, hospice, or residential medical care facility, including any period of incapacity or any subsequent treatment in connection with such inpatient care, or continuing treatment by healthcare provider that includes examinations to determine if there is a serious health condition and an evaluation of such condition. You may also find additional information under the 5 CFR 63.1202. Who do employees apply for FMLA? How do employees apply for FMLA? Excuse me. Forms are available on the VISN 8 Work Life and Leave Awards SharePoint site. FMLA medical certification forms are the following. They're the WH-380E, which is for an employee with a serious health condition, that is for self. And we also have the WH-380F, which is for a family member with a serious medical condition. We no longer, and I know in the past, we have used the OPM 71 to submit with the FMLA forms. We do not need to submit the OPM 71 any longer with the request. It's only the WH-380E or the WH-380F. To submit the completed work forms, you could go to the Work Life Leave and Awards SharePoint, and you go to the year portal, and you'll be able to retrieve information for FMLA, download the forms, or submit your request. If you're not in a VA network, you may email our group, and then we'll be able to assist you with the request. To fax any medical information, you may fax it to 727-299-6878. So the supervisors they can discuss the FMLA parameters with the employee at the beginning of their FMLA entitlement period. The request and update to employee's current FMLA if the employee is invoking FMLA outside of the parameters under which an entitlement has been granted. The updated medicals must be sent via the EAR portal, not given to the supervisor. You may ask the employee to provide an appointment list for future appointments and scheduled treatment visits. When in doubt, please consult the Employee Labor Relations ERLR. Also, some of the common problems that we find with the FMLAs when the documents, when they are turned in, the provider needs to fill in the information in section 1, and it'll ask how long will the condition will last. So it all depends. If it's a renewal of an FMLA, sometimes providers may write such terms as lifetime or ongoing. Usually we do accept that. However, we also request that there's a date for the end date of the FMLA. Example, if the condition is going to last 12 months, the provider could write 12 months, or if there's an end date such as, let's say, December 31st, 2023, we do recommend that the provider does give that information. If this information is not clear, we will kick back the FMLA. So you can reach out to the provider, and they could actually write, the specific of how long the condition of the FMLA will last. Some of the things that we have, like I mentioned before, there is on number 1 and number 2 and number 4 of the WH form, you must answer by the provider. These questions that are here have to be answered by the provider. If there is anything that needs to be corrected or edited, the provider may go ahead and fill out the information again, and the provider will need to initial and date if there's any corrections made to the FMLA. We also have an approval memo for intermittent FMLA. Once you have been approved for intermittent FMLA, because we have 2 types of FMLAs. We have continuous. Continuous is incapacitation when the employee is out for a certain amount of days. If they're out for 12 weeks, they're out for 3 weeks. That will be continuous. If there's an intermittent FMLA, that means that the employee will be out when there is a flare-up and an episode. So that means that the provider will need to be specific to say how long can the employee be out for the month. Example, if they could say up to 2 to 3 times a month, lasting 1 day to 2 days per episode. So once we have this information from the provider, and once we draft the memo for approval, we will write that information. Once it is approved by our supervisor, we will send out this memo to the employee, the service supervisor, timekeeper, and also to payroll. And it will have specific instructions on from what date to what date the employee will be doing intermittent FMLA, and also what will be the frequency and duration for the intermittent status. We also have the paid parental leave memo. For the paid parental leave, the qualifications for entitlement are up to 480 hours of paid leave. The entitlement is the same. You must be eligible. You must be 12 months in federal service to be eligible for paid parental leave. Paid parental leave does fall under FMLA. Once we receive approved, not approved, but proof of birth from the parent, that the baby was born, we go ahead and we draft a memo, and we put from what date to what date the continuous leave. Sometimes, depending on the service, the employee might want to take intermittent leave. They are allowed to do this with the discretion of the supervisor. They might, the PPO will begin the day that the baby is born, and you'll have to the 1 year to the 12 months to do the intermittent basis for the paid parental leave. Under paid parental leave, you will be compensated, and also annual leave and sick leave are accrued on each pay period. And this, like I said before, it does fall under FMLA. So I'm going to give you an example. If you have an FMLA that is active at the moment and you are going to start your paid parental leave, for the 12-month period, you have a total of 480 hours. If you have an active FMLA and you've used 40 hours of that active FMLA and you're starting your PPL, those 40 hours will be subtracted from the 480 hours because, like I said, you have only 480 hours for the 12-month period. Some of the references that we have are as follow. We have the Code of Federal Regulations, which are listed. We also have the SharePoint, the site for the Office of Human Resources Management, and we also have the Work Life and Leave Benefit Service VA Central Office link. And we also have the SharePoint, so you guys could retrieve the WH380E and WH380F. And we reference also with the VA Handbook 5011. So at this time, is there anyone with any questions? Do we still accrue PTO and sick leave while on FMLA? No, you do not accrue any sick leave or annual leave under FMLA. That's only with the paid parental leave because it's a program that we have available for the employees. Under FMLA, you will be under leave without pay unless you want to use your sick leave or annual leave in lieu of sick leave.
I have my hand up.
Okay, ma'am. Yes.
So I'm asking about FMLA. So my thought pattern on FMLA was basically stating that this person has a condition that requires them to be off for certain days or times. And so I have a coworker who came to me and said that she was being talked to about using her FMLA because her appointments for chemo she was taking every Friday. So whenever she had the side effects, they would happen over the weekend, and then she could go back to work on Monday. Well, her supervisor is saying that she's showing a pattern of using her FMLA every Friday. Can that happen?
Well, the provider will need to be specific under the WH380E form as to when the treatments, because there's an area in the form that the doctor could put when the appointments will take place. Now, if the appointments are mandatory to take place every Friday, and like you mentioned, it's chemo and, the side effects, we don't know how each person reacts to that.
Where though? Sorry, there was a mistake.
No, it's okay. So it all depends on what the provider states under the FMLA WH form, ma'am. Now, like I said, if the provider is stating that the chemo is every Friday, I mean that is something that is written under the FMLA, and if it's approved as such, that should be granted.
Okay, thank you.
Yes, ma'am. Ms. Coleman, can you have a question for me? Ms. Vivian?
Yes. Good morning.
Yes.
How this affect the retirement?
FMLA really doesn't affect the retirement. That is something that if you use your annual leave and your sick leave, you wouldn't be accruing that amount of time. When you retire, you'll have used your annual leave, sick leave, and it all depends for that.
Thank you.
So for see for the retirement,
the document.
I was
the impacts of non-pay and estates on retirement.
Right, but at the same time, sick leave is computed into your credible years of service. That means that if you haven't used your sick leave, right, it goes to your credible years of service. And at the same time, like Ms. Stoney said, we do have the non-impact form, sheet that we give when the FMLA is approved. That will tell you also about, what the impact is of using annual leave, sick leave, and FMLA.
Thank you.
Mm-hmm.
I have a question.
Yes. Mr. William. How can I help you?
Do I have to be employed for a year before using FMLA?
Yes, sir. You will have to be employed for 12 months for a year in order to be able to be eligible for FMLA.
Okay, a couple of follow-ups. I had a hard time getting here on time. Sorry if I'm repeating information that you already presented here, but
Oh, no.
I once that year begins, what is the duration of time I have to use FMLA?
Okay, so example, you've been with the VA, let's say starting today, a year. Today's your year anniversary. You're eligible for FMLA. Once you invoke your FMLA and it's approved, you'll have 12 months, depending on what type of FMLA it is. If it's a continuous, if you're gonna be incapacitated, example, for 12 weeks, those 12 weeks equals to 480 hours. Those will be the only hours that you'll be able to use while you're under FMLA. Example, I spoke about intermittent usage of FMLA. Intermittent means that the doctor states that you have a chronic condition, example, a migraine, a condition that will, not allow you to come to work. You will have a 12-month period, depending on the time frame that the doctor gives you, to use the 480 hours during that 12-month period. So it all depends on what the serious medical condition is, and it all depends on how long, the doctor gives you the time frame for that medical condition. And it's equals to 480 hours.
Sorry to interrupt, but my medical condition or whatever is I have a baby. My wife has a baby. I have a baby, and she wants me to be home to help her. So is that part of what FMLA is for?
Okay, so that is the program that the paid parental leave is a program that falls under FMLA. So now, have you been with the VA for a year already, sir?
In your example, this was my year anniversary, but in reality, no, I started in mid-October.
Okay, so if you would like to take time to bond with your family, you are able to request advanced sick leave or advanced annual leave. Or you could also, if your leave has been depleted, your annual leave and sick leave, and you don't have enough hours, you could also apply for the volunteer transfer program. And we do have those programs available in our SharePoint. Now, if you are approved for any of the programs and advanced sick leave or advanced annual leave, those hours will be repaid when you come back from, taking that time off. Once your anniversary comes around in October, if you wish to apply for paid parental leave, you may, and those hours that are granted will have to be used before the baby turns a year old.
Okay, advanced sick leave and advanced annual leave is like using my credit card. Is that the same idea?
Yeah, it's the same idea. You have to, you will get hours granted to you, approved, and once, you come back from advanced annual leave or advanced sick leave, once you're back to work, then those hours will be taken away from your pay, each pay period until you repay those hours back.
Okay, what if I don't want to use the credit card? I want to use my debit card and just use my sick leave and annual leave that I have accrued already. Can I do that?
That will be up to the service discretion. You will have to speak to your supervisor to be able to take that time off, sir. There's times that there's an example that, if one is on maternity leave and you don't want to use FMLA or, well, at the time, back in the days, it used to be like if you were, on maternity leave and you did not want to use FMLA, you could just request if you had the time accrued to use annual leave and sick leave. If the supervisor gave you permission, if they approved it, you could do that. Now, obviously, we have the paid parental leave program, so that is something that that could be used. So
okay,
but
the paid parental leave, does that slow down my retirement time or anything of that nature?
No, sir. No, sir.
Okay.
The only thing that does that is the leave without pay, but not the paid parental leave, sir.
Okay, thank you.
You're welcome. Is there any other questions? I see a hand raised right here. Angela, how can I help you?
Hi, I just want to know, how does the leave without pay affect the retirement? I've asked that question of multiple times and nobody can answer that for me. Do you know?
Well, Ms. Karen,
So the
will you be
time that
able
you've
to
used
assist
on
me?
leave without pay does not count towards your retirement date because you're in a non-pay status during that time.
Okay, thank you.
Yep.
Thank you, Ms. West.
I have a
I see.
question.
Mhm.
If an employee is taking time before the baby starts, let's say they take 40 hours, and so let's say they go out a week before they invoke FMLA, and those 40 hours don't count towards a PPL. Once that year period is finished, then they can use those other 40 hours of PPL.
Okay. So the question is, if the employee takes time before before the baby's date of birth, right? Before you start PPL, those 40 hours, right?
Mm-hmm.
Well, once you're approved for PPL is for continuous or intermittent for a total of 480 hours. So
Okay.
those 40 hours that you have used, they will be just used for annual leave or sick leave, and that's it. Now, while you're under paid parental leave, you will be accruing annual and sick leave. Okay, but you won't be able to use those 40 hours for paid parental leave because those hours of paid parental leave start the day that the baby's born.
Correct. And then since the 40 hours were used for of FMLA, which was invoked, that'll be 40 hours less of PPL they can use, correct?
Yes, now, yes. If they have used 40 hours, yes, those hours will be deducted from the 480 hours that are granted for paid parental leave. Yes, ma'am.
So then in 12, like when that FMLA is at the 12-month mark of the FMLA, will those 40 hours of PPL be able to be used?
No, no, ma'am.
No? Okay, that's what I thought,
Mhm.
but okay, thank you so much.
You're welcome.
Ms. Nino, can you please go over the advanced sick leave, advanced annual leave a little bit more, please?
Sure. Well, advanced sick leave, and advanced annual leave, those are programs that are available to employees that are new or have been employed by the VA. You don't have to have an eligibility to be, to use it. You may request it. The advanced annual leave and advanced sick leave, there's a parameter of hours that you could request. And you could use by the end of the year, meaning that if it's an annual leave, you have 200, if you're a Title V employee, you have 240 hours. We're right now in pay period, I believe 13 or 14, I'm not too sure at the moment. So whatever hours are left for the year, if an employee asks for advanced annual leave, it could only be the amount that's remaining for the year. And that's the same thing that applies for advanced sick leave. Once it's approved by us and we send the communication out to the service, employee, and payroll, and the employee uses the advanced sick leave and advanced annual leave, those hours will be paid back once the employee is back to work.
Thank you.
And yeah, and you will need to provide, sorry, just one more thing. If you're doing advanced sick leave, you will need to provide supporting documentation to support the request. Okay, so what I'm gonna do, since we have time, I'm gonna go ahead and share our SharePoint with you guys, so you guys could see how our SharePoint works and the different tabs that we have available for the different leave groups. So I'm gonna go ahead and go back. Give me 1 second. And you'll go ahead and you'll start with your name. The date is automatically populated when you start your request. The site, example, Miami. The service, we'll go ahead and select facility management. The phone number, you will type your number. The grade, GS7, The manager, you will put your manager's name, which is your supervisor. The program that you have selected will be FMLA. Once you go ahead and attach, you will go ahead and select to attach your forms. If there's any notes that you have that you want to give to your HR specialist that you're going to be assigned to, you could type any notes that you want under the notes and comments. You also will fill in the date that you invoked your FMLA, and the invocation date is the date that you spoke to your supervisor that you want to invoke FMLA. It also is the date that you have completed your FMLA paperwork and the doctor has signed it. So usually the conversation first starts with your supervisor, letting them know that you are invoking FMLA. So I would suggest that that will be the date that you put under this tab. Once you have attached the form, it will give you the option to submit request. If you see that this gray out tab is not green, that means that there's something missing on the questions or the information that was asked. Once this turns green, you may submit your request. Once it submits, we get the notification. An HR specialist is assigned to process your FMLA. And anytime that there's an update, you will be notified that there's an update for your FMLA. If there's no updates, that means that the FMLA is processed. It gets sent to our supervisor for review and signature. Once we get the approval memo, that is when we send that memo to the payroll department, to the employee, the service supervisor, timekeeper, and that's it. So that's how our requests work. Do I have any questions in reference to this?
I'm trying to practice when to SharePoint. So in SharePoint, then after SharePoint click, what do you do?
Okay, so if you're in the SharePoint, you should come to the page. Give me 1 second. Let me go back. Hold on a second. Go ahead and go home. Okay.
Should I go to the start page?
Okay. So once you click on the SharePoint, you should come to this page, ma'am, that has the tabs. Do you see that? Oops, sorry.
No, I lost you.
Okay,
Here.
give me one second.
So I go to SharePoint, and then how I get to that tab? I need to type that to find the.
No.
Doesn't come automatically in my SharePoint.
Okay, give me 1 second. It doesn't populate automatically. Maybe it needs to be approved. Does it give you an option to be approved to get into the SharePoint?
No, maybe because I changed PIV card yesterday, I will play around. But usually this auto-populate when I click SharePoint?
Yes, ma'am.
Okay, thank you.
Yes, ma'am. Yes, and you're welcome. And just to let you guys know, also, we have the different tabs for advanced annual leave, advanced sick leave, awards, childcare subsidy. These are other programs that we work with. Employee assistance program, the emergency leave transfer. We have the leave without pay. We have the paid parental leave bereavement, paid parental leave, restore leave, telework, volunteer leave, and weather and safety leave. So if you click on any of these tabs and you have any questions about the program, the tab will give you information about the program and able to download the forms. Now, a lot of the times I do get asked when someone wants to inquire about paid parental leave and FMLA, some employees think that they have to fill out the FMLA paperwork, the form, in order to apply for paid parental leave. And that's not the case. When you are applying for paid parental leave, the only forms that you are requested to submit with your request is a 12 work week obligation agreement and also the paid parental leave request form, which requires a supervisor signature. So if you are applying for paid parental leave, know that you do not have to fill out the WH-380. You just need to complete those 2 forms and submit them with your request. Because I do get that question asked often. Do I have any other questions?
Hi, good afternoon. Yes, I just have a quick question. What should we do if if the if the staff member has been approved for a certain amount of FMLA and they have gone over or they're requesting more than what they were approved for? So what steps do we need to take in regards as the approving supervisors, as far as, educating the staff or informing the staff member that they've exceeded the amount of hours, or should we refer them back over to HR?
Well, okay, so are you talking about, for example, an employee that is approved for intermittent FMLA and they have a certain amount of days that they could take during the week or the month, right? Stated by the provider, and they are taking more time that exceeds of what's been approved.
Correct.
Okay.
So for instance, if I have a staff member that was approved for, we'll just say 240 hours of FMLA use, and and they end up putting in for another week of FMLA, which is going to put them to 248 hours. And so, because I know it creates a payroll issue and everything, so how do we need to approach this?
Okay, so the employee, so as a supervisor, I would suggest, or I would tell the employee that they need to get updated medical documentation. They need to contact the HR specialist that they were assigned to when they were approved for their FMLA. Then once the employee contacts that HR specialist, they will give them the updated medical documentation, and then amendment could be done to their FMLA. If that amendment is approved, then the HR specialist assigned to that employee will notify the service, payroll, and the employee that there was an amendment. And the amendment will state what was changed. If it was more time, the dates, or the frequency and duration has changed. So it all depends. But an amendment can be done to an FMLA.
Okay, and so could that amendment be applied as a retro if the leave was approved and unknowingly we find out that we didn't calculate correctly? So could that be a retro as well?
Okay, so it all depends when the employee spoke to the supervisor to invoke the FMLA. Okay. And it also reflects on beta. Sometimes the employee may place that request of FMLA in betas, and we could go back and verify, but we cannot go back 30 days prior to retro if the employee has not spoken to the supervisor or it wasn't inputted into betas. It's a 30-day, and yeah.
Okay,
Does
so
that
as
answer
long
your
as
question?
correct, I just wanted to make sure because it hasn't happened, but I like to be proactive and have answers. So if I come across a situation and I'm looking that the coworker has, is very, very close or has actually started to go over, and I notify them immediately that, so then that way we can be we can be proactive together and everything, and say, hi, I'm looking at this. I don't know if my Excel spreadsheet says this is the amount that you've used. Veta says this. Please reach out. Let's try and coordinate this and be proactive so that there's not any type of leave without pay or if something creates a deficit.
Right. And also when you mention leave without pay, sir, you also have to understand that if the employee has used FMLA, right, and they've used their annual leave and sick leave, and their hours are depleting because they've been out, let's say, for 240 hours, they could also apply for the volunteer transfer program if it's a case that they need to. And then with the volunteer transfer program, they could actually submit their FMLA paperwork as supporting medical documentation, and they could apply for that program.
I have recommended a couple of coworkers in regards to those situations. I have recommended for them to reach out and explore that that avenue.
Yeah. Yeah, but we're here
Okay.
to help them. We're here to help our employees. So if the case is that they're, if they have overused the time that was approved under the memo, like I said, there could be an amendment that could be done. They just need to reach out to their HR specialist that they were assigned, and that shouldn't be a problem, sir.
Appreciate it. Thank you.
You're welcome. Do I have any other questions?
Yes, I asked the question earlier in the chat. Well, if your FMLA expires, right? Say for instance, your FMLA expires this month. When would be your next eligible period?
Okay, so if we're talking about a renewal, right? Are you talking about a renewal,
Yes.
Alberta? Okay, so
Yes.
example, an FMLA was approved from June 22nd, 2022, right? And it's for a 12-month period, and it would end on June 21st, 2023. So that means that the FMLA for renewal will start on June 22nd, 2023. And if the doctor states that it's for 12 months, then it will be renewed for the 12-month period.
Okay, so it's not necessarily because my understanding is per calendar year. And so if it started in a calendar year and you used to its extent, or it's been extended, or you didn't quite use all your hours, but whatever the case may be, the overall expiration date is 1 year, that 12 months, right? So once it expires, do you have a period in between before it gets renewed? I guess that's
No,
what I'm asking.
the renewal, if it's a renewal and the doctor and the provider has stated on the WH form that it was for a 12-month period, and you get that for a 12-month period, you would use your 480 hours, right, for that 12-month period. If the doctor, for example, it's an intermittent or continuous, and it gives, let's say it starts June 22nd of last year and he gave you till January of this year, and you haven't used your whole 480 hours, then you could resubmit a new FMLA to complete those hours for that 12-month period. If it's for a different medical condition, or if it's for the same medical condition, you could actually do an amendment to the current FMLA to complete the 480 hours.
So if the amendment was done, right, and it was said that it will expire this month, and say, for instance, you're still needing to have care, then would it be another amendment?
No, you would just do a new FMLA for the following year. It wouldn't be it wouldn't be an amendment. It will be a new one, a new request.
Okay. All right. Thank you.
You're welcome, Ms. Alberta. Do we have any other questions that anyone would like to ask? You could ask me anything. We still have a few minutes left. I don't know if I was clear with everything I presented today. It's a lot of information. FMLA could be a little bit complicated. You know what? I will touch base on something. Usually with our WH forms under the medical facts, sometimes providers don't write clearly what the medical condition is for the employee. That's one of the things that at least me as an HR specialist, I have been returning or kicking back a lot of FMLAs because I don't have clarity on what the medical condition is. Sometimes the medical condition is not listed under the medical facts. So that will be something that I will recommend that, if you're a supervisor and you have that conversation with your employee and they're thinking of invoking FMLA, obviously they don't share that information with you. But when they do submit their request, please make sure that the provider specifically, gives a summary of what the medical condition is. There's conditions, like I mentioned in the presentation, that are not eligible, like plastic surgery, or pharmacy, to pick up prescriptions, or just other things that are like sinus. It all depends. It all depends on what the medical condition is listed. So just make sure that the medical facts are properly annotated. So when we receive the request, we could process the request in a timely manner, because that's one of the things that I've been dealing with, quite some time. Now, another thing that has been told to me by a couple of employees, that because of the HIPAA violation, why is it that us as HR specialists have to have so much information? And I've explained to employees that, the provider would just need to give a little summary of what the condition is, and that we are the only ones that see that information. So that wouldn't be violating the HIPAA violation. So that's one of the things that I have encountered in the past month. So just wanted to, let you guys know about the medical facts. All right, so I guess you guys get a few minutes back. It's 12:47. Like I said, this presentation is being recorded. Once we are done, the presentation, the recording will notify in the chat that it's been concluded. So my name is Sandra Nino. It has been a pleasure presenting to all of you. If you guys have any questions, you could send me an email, Teams message, or you could send our team an email, and we'll be more than happy to help you with any questions that you might have in reference to our leave group. Thank you, everyone, for being present today. I really appreciate it, and I hope that I've answered all of your questions. And thank you to my team again for all of your assistance with the presentation. Have a great afternoon, everyone.
Thank you. Thank you.
You're welcome.
Thank you.
Thank you.
You're welcome. You're welcome.
Thanks so much.
You're welcome. Have a great afternoon. Thank you.
You too.
Thanks.